Hello there, my name is Dr. Linus. I am a pharmacist. I live in Uganda. And if you're visiting this channel for your very first time, do not forget to click the subscribe button, because on this channel I educate and inspire. Today I want to talk about something that you didn't know about this virus that has caused havoc all over the world, causing all economies to shut down, economies to be disturbed, to be disorganized, lockdown to be everywhere. What do we need to know about this coronavirus? In a branch of science that we call microbiology, where we pay detailed attention to the structure of the different microorganisms, this coronavirus was found to have a structure that looks like the crown. Because the structure looks like a crown, you know, the crown that the kings, the kings and the queens wear. So that kind of structure, if you're speaking Latin, you call a crown corona. And so because this virus, under submicroscopic examination, looked like a crown, they were able to call it the name corona. And so because it's a virus, they called it coronavirus. Latin as a language has actually contributed a lot of words that are used in medicine, in law, in generally science. Latin has contributed a lot of words that are used in those different learning areas. Okay, and this coronavirus was first discovered in 1965. People were found to be developing common cold, and because of that, of course, no one is comfortable with a common cold, so you want to know what is really causing this. And it was discovered that actually what was causing it was an organism that had a crown-like structure. So some of these viruses cause infections in humans, while others cause infections in animals. Animals like cattle, like camels, bats. Bats have been known to be a common host of these viruses that fall under the family of coronavirus. It is even thought that many of these other coronaviruses that have come out have come from bats. Between November of 2002 and July of 2003, there was an outbreak of a condition that was known to be caused by a virus, and they called this condition severe acute respiratory syndrome. So that term, severe acute respiratory syndrome, was then abbreviated, and the abbreviation was SARS. So they discovered that the condition called SARS, which is the severe acute respiratory syndrome, was caused by a type of coronavirus. That was between November of 2002 and July of 2003. And this actually happened in China. So because SARS, and I told you SARS stands for severe acute respiratory syndrome. The word syndrome is a medical term that means many symptoms. If many patients are presenting with a similar collection of symptoms, then now we call it a syndrome. So many patients were seen to have severe acute respiratory syndrome, and some of the symptoms that formed that syndrome included, among others, fever, cough, breathing difficulties, pneumonia, So when you see many of those symptoms in many patients, then it is a syndrome. So I was telling you, since this syndrome was caused by a type of coronavirus, they decided to call this virus SARS-CoV. At least 8,000 cases were recorded. That was the first outbreak that happened in 2002 in China. Then, in 2012, there was another outbreak that happened still in Asia, this time in Saudi Arabia. And there was a disease that they decided to name Middle East Respiratory Syndrome. Now, Middle East Respiratory Syndrome was also found to be caused by a type of virus that has a crown-like structure. Middle East Respiratory Syndrome was then abbreviated as MERS. So, MERS was the disease. Because the virus causing MERS was a type of coronavirus, okay, then the virus was called MERS-CoV. MERS-CoV. Okay, that was in 2012. There were at least 2,500 cases of MERS that were reported. 858 people were recorded to have died because of MERS. The good news with MERS was that it was found not to be less contagious. But then, even as less contagious, MERS was actually said to be more deadly than SARS. Because while the symptoms of MERS are similar to the symptoms of SARS, MERS was actually found to also cause kidney failure. So if something goes beyond the chest, goes beyond the respiratory system, and even causes the kidneys to get failure, then you want to think that actually MERS is more deadly than SARS, though less contagious. Now, just recently, last year, we are in 2020, but in December of 2019, there was a reported outbreak of a similar disease to what broke out in 2002 in China. So the presentation of this disease was similar to the one that was seen between November of 2002 and July of 2003 in China. And so the disease presentation was a severe acute respiratory syndrome. So there were a number of symptoms that were similar to the symptoms that were seen in 2002. Now, when they looked at the virus that was causing this disease had a resemblance. The structure and many other aspects was similar to the virus that caused the severe acute respiratory syndrome of 2002. Now remember, the one of 2002, November, was named SARS-CoV. Now, because this virus was also a corona type of virus and was quite different from the one of 2002, because you remember the one of 2002 did not reach our country. We did not report any cases. But this one of 2019 has been more dangerous, has been really serious. So they decided to call it SARS-CoV-2. The first one was called SARS-CoV. Now, if this one now is being called SARS-CoV-2, by default it means the first one becomes SARS-CoV-1. But you can simply call it SARS-CoV. I know you've had some of those terminologies, SARS-CoV, SARS-CoV, and you've been confused. So this one has been named SARS-CoV-2 by the taxonomists. Taxonomists are the scientists who have specialized in the area of naming microorganisms and generally organisms. You get that point? So, the disease was then given the name COVID-19. So, SARS-CoV-2 causes a disease called COVID-19. Though the World Health Organization prefers to call the virus a different name. They prefer to call it a name different from what the taxonomists decided to call it. So you hear WHO name or call the virus COVID-19 virus to make it very easy for people like you and me. COVID-19 virus. Why do I have to confuse you with the name SARS-CoV-2? So WHO just made it very easy, the World Health Organization, and they chose to call it COVID-19 virus. So, the COVID-19 virus has proven to be more virulent than the virus of 2002. And that's why all over the world, everyone has been affected, every country has been affected, people have lost their jobs, schools have been closed, businesses have collapsed, economies have collapsed, airports have been closed, just because of the COVID-19 virus, which has proven to be more virulent than all the other viruses. So therefore, if you've been watching this video from where I started, do not forget to subscribe to this channel, because on this channel, I'm determined to educate and inspire. Secondly, COVID-19 has affected every country world over. In Uganda, where I live, we are still lucky that we haven't yet reported any death, but of course we've reported many cases and we've also seen many people recover. But our economy has equally been affected, schools have been closed, businesses have shut down, many things have been affected. So therefore, I want to encourage you to wash your hands as much as possible and as frequently as possible. WHO recommends over a period of 20 seconds you washing your hands with soap and water. If you cannot handle that, you can have yourself a hand sanitizer. I personally use InstaClean. And InstaClean is one that I really trust personally. It has done so well for me. Okay, it has quite a high percentage of alcohol. 80% of alcohol is found in InstaClean. So you can look for InstaClean in Uganda. If you're in Uganda, it's available in many of these shops, supermarkets, pharmacies. You find InstaClean there. Request for it. Also, if there is no reason why you should leave home, please stay at home, because we want you alive as long as you can stay alive. Importantly, also avoid touching the mouth, the nose, and the eyes, because those are good access points for the virus. So if you touch them, you're not sure whether your hands are clean or contaminated, you may end up infecting yourself. So thank you very much for watching this video. Allow me to wish you a nice day. Bye.